What the Department of Health and Welfare plans to do with their allowance. Live from the Capitol.
To push back against the opioid crisis, the Idaho Department of Health and Welfare is getting more than $4 million this first year and more than $10 million in the first few years. I spoke to a program manager there to learn where exactly this money is going. Beginning October 1st, $4.1 million is going to the Division of Behavioral Health. According to a program manager, the two goals are access.
When somebody's ready for help, we want to make sure that the help is there. Because sometimes I always tell people that window's open for 15 minutes.
And ending harmful stigma.
The more we talk about this, the more we get it out, the more we make it safe for people to be able to talk about and ask for help.
But this grant is not the only thing making an impact on where they'll direct their funds.
Up until now, we've had to spend a majority of that funding on treatment for individuals because, literally it was a life or death situation. And so we put a majority of our funding in treatment, including medication-assisted therapy. Now with Medicaid expansion, the estimates are that over 90% of the folks we've been treating will be eligible for Medicaid. So they'll be able to get their treatment services through Medicaid.
This, she says, will allow for more support of supporting services.
Allowing us to use the funding that we would have spent on treatment for other services that are quite necessary for recovery, such as transportation, safe and sober housing.
Some other priorities for the funds include naloxone distribution, a law enforcement assistant diversion project where in lieu of arrest a person is actually offered treatment, youth prevention programs, the 9 Idaho recovery centers, a pilot with the Walker Center in Gooding, Idaho, where residential treatment is offered longer than the 30 days they currently offer.
Treatment is great, but treatment tends to be this much of the journey that, the journey is from here to the rest of your life.
And a reentry pilot for inmates being released from the Women's Correctional Center in Pocatello.
I hope we do enough prevention in this state that someday I'm out of a job. That's how I'd like to see it.
Rosie says those in need of help with recovery shouldn't be discouraged to reach out to BPA Health at the number on your screen. That's the contractor the department works with to set up people with local services. Live in Boise, Madeline White, 6 on your side.